we have to give a PPD, let's say, and we're gonna use our intradermal needle. And if you look at the package of this, do you see, it says 27G, do you see that? That means it's 27 gauge, so it's skinny. If it said 16 gauge, it would be fat. And then ½ inch, so it's short. So it's 27 gauge, ½ inch. So that works for my TB needle, right? 27 gauge, ½ inch. So, you should have your little vial. So you're gonna peel this open. We washed our hand, so in reality, you're gonna be in the med room. I suppose there's situations where you could be at the patient's bedside, but for the most part, we're preparing this in the med room. So you're gonna wash your hands. Do I need gloves to prepare this? What do you think? No, unless it's something caustic or like irritating to me, like if I was preparing something to give for chemotherapy, which you guys are not gonna do, I would need gloves or double gloves, but just to prepare my injection, I just need clean hands. I don't need to put gloves on. So you should have a white cap on the top of your vial. You're gonna flick that cap off. That's garbage. They don't go back on here. This is not guaranteed sterile, this rubber stopper. So you have to swab it with alcohol, even if it's brand new. So you're gonna take your alcohol swab, one-time use. One time. You're gonna swab the rubber stopper and then you're gonna throw that away. All right, this is my patient. We're gonna get that out of here. So you're gonna peel your, so I can't touch that now, right? What happens if I touch this?
You have to redo it.
Right, I have to re-swab it. I'm gonna open this. That didn't open very nicely. I'm bumming about that. All right, you're gonna take this out. Some needles, like this particular intradermal needle and insulin needles always, the needle is attached to the syringe permanently. It doesn't come off. You're gonna see when we do the sub-Q, the subcutaneous and the intramuscular, the needles do come off. This is attached, it does not come off. When the needle comes off, sometimes you'll see nurses use what's called a fill needle, F-I-L-L, a fill needle. It's only for withdrawing medication from the vial. It's not for injecting. You don't have to use it. It's up to you if you want to use it. I never used to use it, and now I've gotten in the habit of using it. I really like using the fill needles because it's 18 gauge and it's just so much easier to draw from the vial. But like, you don't have to use it. It's totally your call as a nurse. And you're gonna see some nurses use it all the time, some never use it. You know, we're only puncturing this rubber stopper one time. I'm not concerned that I'm dulling the needle. So if you wanna draw up without the fill, you can. I personally think it's easier with these. That's just my opinion. So you probably don't use them.
I never use them.
You never use them. All right, so this cap right here, right? You're gonna pull this straight off. Don't pull. And then you can put it down. I always like to put it down inside the paper. I'm sorry, I hate to say it, but those med room counters aren't always the cleanest counters in the world, so I always put it there. If you have a multi-dose vial, right? Oh, look, she's frozen there.
No,
She's
well,
like,
I accidentally flung it, like it's like under the bed.
the cap?
Yeah.
Don't worry about it. It's garbage anyway. Well, it's not really garbage. You're gonna. Don't worry about it for now. Don't worry about it. It's okay.
Sorry.
So.
You're fired.
Yeah.
You're a nurse.
You failed. No. So, we have multi-dose vials in front of us. When you have a multi-dose vial, you will see nurses inject air into the vial before they draw up the solution, and they inject air equal to the amount of solution that they're going to draw up. And the whole has nothing to do with the patient. The whole reason is for that is when you don't replace fluid with air in a multi-dose vial, sometimes it creates a vacuum. So you're trying to pull on your plunger and it keeps getting sucked back up into the vial. So that's why we add air. adding air is not a make or break thing, you guys. We don't care whether you add air or not. If you're having trouble drawing it up, push some air in. Like, I think students get like, oh, I forgot to add. We don't care. It's not. And honestly, 99% of what you draw is gonna be a single dose vial. You don't have to put air in a single dose vial. I'm gonna use it one time and I'm gonna dispose of it. Not only that, some of the single dose vials, I'm not kidding you, if you put air in that, it cracks because there's no space in the vial for the air. So, you know, you might be in clinical and your instructor might be like, why didn't you inject air? You don't have to inject air. I just feel like if you're getting your plunger and it keeps getting sucked up back into the barrel, then you can inject some air. But since we're gonna reuse these, we'll inject some air. So let's say this is an intradermal injection, and remember we can't give more than 0.5 ml. So we're gonna give 0.2 mLs. So, again, you see this? I'm gonna be poking myself if I
Here, I'll
don't cover.
point to it.
Yeah, pointer. You see where the point, here, I'm gonna go on here. You see where the 0.2
When you
is?
look at your
The
syringe, you'll
flat
see like
part,
point
you guys.
1, 0.2.
See mine up here? So a lot of times I go backwards. And then I push it to what I need.
Yeah, go past it and then come back up.
And your rubber stopper on the plunger is flat, so it's the top part of the flat part of the plunger. Some of them are dome shaped. See how it's dome shaped there? Then you don't want the tip of the dome, you still want the flat part of the black rubber stopper there. All right? And honestly, if I had gone this long, I would swab this again, but we're not gonna swab again. So, you drew back your air. This is a multi-dose vial, so I'm gonna inject some air. And just go right in the center. These needles are really skinny, so they bend easy.
Because they'll bend, go straight in.
So go straight in. I'm not a big fan of this when you're like holding the vial and going like this, because sometimes you're so nervous. It's like, please put the vial down on the table. And then just inject the air, leave the needle in there, and then pick up the vial and turn it upside down. And then pull back on the plunger to get your 0.2. So if you see air bubbles, sometimes you have to flick the air bubbles so that they go to the top of the syringe and then you push them back into the vial, if you happen to have it. And these are so, I like to use a pen to whack up the air bubbles. Like I have a few clinging to my plunger there. Why do we care about air bubbles?
You don't want to inject that in.
Why was that?
Does that cause like, is that an embolism or like a?
It actually does not cause an air embolism. You need a lot of air, like 15 mils of air to cause an air embolism. The problem with air is it displaces the medication, so you're gonna have an incorrect dose if you have a big air bubble in there. So you have to get rid of the air bubble, or your dose is gonna be incorrect, because the air is gonna take up space. So a lot of times, I don't know if you saw what I did, like I pulled past the 0.2, I flicked my syringe, and sometimes I use a pen. You really gotta whack it, you guys. And then once the air goes to the top, then I push it back into my vial.
Because if you just go to 0.2, right, and you have air in there, and you flick it to the top, when you push it out, you're gonna be below 0.2.
And then you're gonna have to go back into your vial.
Pull past what you need, like 0.3, 0.4, flick all your air out, and then push right up to the 0.2, and then you're in the right
And
place.
even if you had a single dose vial, there's always excess in those vials.
Yeah,
So if it
there's
says it's like a 1 ml syringe, it's always like 1 point, there's always excess, so you can pull back a little more and then push back to what you need.
Is that why they use the fill needles a lot now, just so you don't like bend the needle by chance?
Well, this needle doesn't come off, so I can't use a fill needle. So, and the insulin needles don't, those are the ones that bend. These and the insulin ones, no, we use it convenience. It's 100% convenience, really. And I like the fill needles. The biggest thing about the fill needles is they're long, and sometimes you have to be careful if you're above the fluid level in the vial when you're pulling back the medication, you end up pulling back a lot of air. So does everyone have do you want us to check? Does everyone have their